Good morning.
Hey, how are you?
Good. How are you?
Good. I am letting people in slowly as they pop up.
Sounds good.
Yeah, let's see. Is
Am
that?
I the only, am I the only one in just yet?
No, there's a couple other people who are joining.
Okay.
Yeah, so we're gonna talk about PCOS, which is very
Would you mind if
exciting.
I'm gonna do this like super quick? They just started it. Yeah. Yeah. It was like
I'm gonna mute everybody. Yes. Okay. So, as people come, I'll add more, but I'm Elise Clark, nurse practitioner here at Alive and Well, and I'm going to talk about PCOS. It is PCOS Awareness Month, which is fun. And it's to me one of the more, I don't want to say fun because it's not necessarily fun, but it's one of my favorite things to talk about and to treat because it's often misunderstood. So I love helping people understand their particular body, what it really means, and kind of help guide them in treatments that might be a little bit different than the traditional setting offers. So PCOS is often considered a problem of the ovaries, but it's actually a problem with your metabolism. So we think the ovaries are the problem, but the root is actually how your body processes insulin. So the issue starts way before your ovaries are having issues. But because a lot of the dominant symptoms then present as cycle issues, ovarian cysts, we think the ovaries are the problem. But what really happens is as your body stops using insulin efficiently and you become resistant to that hormone, and that hormone I should explain a little bit more about too. It's the hormone that our body uses to regulate our blood sugar. So as our blood sugar goes up when we eat, we release insulin, it grabs that sugar, it puts it in our cells, we use it hopefully where we're supposed to. But from a lot of different reasons, primarily genetic being some that affect PCOS, lifestyle, the functional space, we often find there's other issues going on like gut problems and toxicity and issues with detoxing. We'll often see those contribute to this as well. But regardless of why it happens, the issue becomes insulin resistance first. And when your body stops processing sugar well, and your insulin levels stay higher, that causes disruptions with your testosterone levels and something called sex hormone binding globulin. So that then causes the cycle irregularities like not ovulating as efficiently. So you can have longer periods, you can have shorter periods, you can miss periods. And then even if you're having periods, sometimes people don't ovulate. And then another big symptom that will often bring people in to get checked out for it is just they get a lot of pain on one side, they go get it checked out, and someone says, oh, you have cysts on your ovary. So a lot of the conventional treatments are geared towards just shutting down the ovaries, like a birth control pill. What that would do is kind of mask these PCOS symptoms. So PCOS, because it is ultimately at the end a hormone issue, if you add in birth control pills, it suppresses your body's own production of estrogen, progesterone, and testosterone to a certain extent. So if your ovaries aren't actively having to make those hormones, you technically don't have all of the symptoms, which is great in theory, but that's not our long-term solution. So that's kind of more the mainstream treatment is shut down your ovaries so you don't have the symptoms, you don't have the side effects. But then what happens when we come off of the pill is you still have the same problem. So I'm not saying I'm against using birth control pills in certain situations for this, but I think as a first line choice, it's not always going to help you get the end result you're after. So some of the main symptoms that people will experience, like I said, that are actually having ovarian cysts, irregular cycles, issues with their cycles, but some of them are a little more nuanced. Some people with PCOS will have regular periods every single month, and then they'll go to the doctor for other symptoms and be told, oh, well, it can't be PCOS because you have a period. And that's just not true. So what I will often see is kind of a spectrum of symptoms. If you're on the kind of lower end over here and just have a few symptoms, you might experience more of a predisposition to acne, maybe a little more predisposition to hanging on to weight. A lot of times I'll start to see some lab changes like slightly higher insulin, slightly higher cholesterol. And then that kind of bleeds into this whole spectrum on that would be the low end. On the high end, with people that have really severe symptoms, what I'll see is major issues with losing weight, not having periods, a lot of extra hair growth where you don't want it around your face, losing hair on your head, having just very sluggish metabolism in general. And then of course, if we end up doing sonogram and looking at the ovaries, there's often cysts there. So you kind of see this spectrum, and I think this is why a lot of women don't get diagnosed appropriately, because if you don't fit the typical model of being overweight and having acne, it can be ignored, unfortunately. But I have a lot of thin patients that have PCOS, and I have a lot of really active patients that have PCOS, which is not typically what you would expect. So how I kind of go about it is with your labs, if you're concerned about this, having some symptoms, or we're just doing a good workup on a patient, what I'm looking for is your estrogen, progesterone, and testosterone balance. A lot of people with PCOS, their testosterone levels will actually be normal, but they will have a lot of testosterone that is in the free form. And when testosterone is in the free form, it hits your cells and causes more of the side effects. Like it can disrupt ovulation, it can cause the acne, it can cause extra hair growth on your chin, your face, and cause you to lose hair. So it's more about the free testosterone than the actual overall amount that you make. And that is what has to do with this sex hormone binding globulin. That is a protein that helps you bind up extra hormones. And with high insulin levels, it suppresses your production of this protein in your liver. So then you have all this free floating testosterone that can cause problems. So that's really more the issue is the free testosterone. So often see that level is either high or high normal. I'll often see insulin levels that are maybe not too high, but getting close to the border of being too high. And depending on which lab you use, that kind of determines what range I like to shoot for. But in general, you want your insulin level to be less than 10, and then less than 6 is ideal. So if someone's getting over that, I'm starting to get suspicious. And then another finding that I often see is high triglyceride levels, because if your body is having trouble processing sugar, your triglyceride levels tend to be higher, which is a particular type of cholesterol that is related to sugar production. So those are a little more of the kind of nuanced things that I will see. And then of course, talking to the patient, if they've been acne prone their whole life, if they have trouble losing weight, if their periods are a bit more unpredictable, then I'm more likely to make that diagnosis. So it's not just, I see a cyst on your ovary and that's what makes the diagnoses. I like to look at all the labs and all the metabolic markers, because that's really where the issue lies. So in treatment can be, stopping the ovaries for a while with a birth control pill if you're having major issues, but again, that's temporary. So how I approach PCOS is looking at your whole metabolism. If the issue is insulin resistance, that needs to be our main focus. And depending on how severe it is, that determines what avenue we take. But in general, working on your nutrition and exercise is probably the best thing that you can do. I've like at some of the conferences I go to about PCOS, some doctors will say that you can out exercise PCOS, which is a little bit extreme, but the point is exercise does cause sensitization to insulin, because as you're exercising, your muscles have to uptake glucose for fueling that activity. So then you have to use insulin to transport glucose. So then your body gets more sensitive to it. So exercise is a really key piece to PCOS management. Not saying you have to go join CrossFit and do that every day, because that's pretty intense, but moving the body and building muscle tone to a certain extent and kind of individualizing what works best for you. But consistent movement, consistent exercise really is probably foundational to PCOS. And the other part is looking at how your blood sugar is throughout the day, looking with a continuous glucose monitor, or just working with our nutritionist in combination with that, or by itself, to track your food, your macronutrients, how you're eating throughout the day to make sure that your blood sugar has a chance to stay a lot more stable. So nutrition's foundational, not doing a lot of processed food, avoiding added sugar, but more than that, it's making sure you're also eating enough fiber, eating enough protein, and having those consistent meals throughout the day. Because while some level of fasting can be helpful for insulin resistance, if it's a hormonal issue as well, it can actually work against you. So unless my patients are older, closer to menopause, I don't often encourage really long periods of fasting, because I find that it can actually cause more stress on the body. So with PCOS, it's about lower carb, lower processed food, not no carb, just lower, higher protein, higher fiber, and eating consistently throughout the day. That is really helpful for blood sugar balance, which again is the root of this problem. So we work on those foundations. Mel, our nutritionist, and Jenny, our health coach, are amazing at helping with that. They've done wonders for my patients. And then outside of that, what I do from more of a medical perspective with supplementing is inositol has been shown to be very helpful for blood sugar and insulin balance. And it actually helps regulate how how insulin is taken up into the cells and then lowers testosterone. So inositol is a supplement that I use for pretty much every PCOS patient that I have. Doesn't work overnight, but over time, this inositol helps balance out insulin and testosterone. It also has a positive impact on your blood sugar as a result, but some of my patients who might not be as good about taking multiple supplements will just do the inositol and see really good results. I will often do berberine too, which is an herb that helps decrease sugar spikes when you're eating. So if we recognize, hey, when you're eating, you're getting these big spikes because we did a glucose monitor, we're tracking your food, then I'll add in some berberine as well, which helps dampen the sugar spikes when you're eating. So we time it with food a little bit. So those are two that really help with the insulin resistance aspect, along with doing the lifestyle changes. But a bigger piece is making sure we're addressing the whole body. What nutrients are you deficient in? B12, folate, vitamin D, magnesium, iron. We have to make sure all of that's working to support cellular function, because even if you have better insulin control, better sugar control, if your cells aren't able to use those things for energy efficiently because you're missing other nutrients, you're still going to not feel your best and still potentially have symptoms. So we always look at that. I do measure the estrogen, progesterone, testosterone. So the inositol and berberine can help lower testosterone levels, the free. And then if you're really high on testosterone, it will suppress your progesterone. And progesterone is a hormone that is great for calming. It's great for sleep. It really offsets some of the excitability side effects of testosterone and estrogen. So the goal is that you wouldn't need something like that long term if you're on the younger side, but we can add in progesterone to help really mitigate some of the side effects of PCOS. It's very safe. It's not the same kind of hormone that's in birth control pills. It's a bioidentical progesterone at a very low dose. So it just helps balance out that estrogen without causing any inflammation or potential disease risk like the fake hormones can. So I often will kind of add progesterone in to help manage things for a little while, and while we work on the lifestyle, the supplementing. And then in extreme cases, sometimes we do need to use prescription options, and that's okay. I like to kind of meld both worlds, Western and the more holistic mindset. So if someone has really significant sugar elevations or major insulin issues, and we're having trouble getting them down, metformin is kind of the first line for diabetics and insulin resistance. And it is really well tolerated by most people, not everybody, but most. And so I will jump to that if needed to get tighter control of blood sugar. And oftentimes it's used in the traditional setting by OBs and fertility doctors in women who have PCOS, because there is a lot of good data on helping with ovulation, making that a little bit more predictable. So that's a little heavier hitting item that I do use. And then on the other kind of more Western option that I will do is spironolactone. And that's more for symptom management. So spironolactone is actually a blood pressure medication, but the side effect of it, which ended up being kind of a positive side effect, is that it decreases androgen or testosterone stimulation on your skin. So in women that have really bad hair growth on their face, which is called hirsutism, or have really severe acne, we can do spironolactone at very low doses. So we don't get blood pressure issues, but over time, it decreases that stimulation on your skin. So the physical side effects that might cause people issues more with like self-esteem and things like that, we can get that cleared up a little bit faster. There's an oral option that can impact your blood pressure, so we're a little more cautious with that. And then there's also a topical option. I've used that quite a bit recently for acne specifically, and it works really well with less side effects. So really my approach is we have to get to the root. We have to get to why you're having PCOS symptoms, which is the insulin issue, the high testosterone, more of the metabolism. We have to fix that aspect. But at the same time, we can be doing these options that have a little more immediate impact, like the metformin, like the spironolactone and progesterone, while we work on the underlying issue. Because even though over time, I know these functional approaches really work, it's also about, hey, we want you to feel good. We want you to feel good as quickly as possible. And some women who've been struggling, especially with the acne their whole life, it can be life-changing just to get that part of it cleared up a little bit more quickly. So those are some of my foundations. And then also big things would be stress management. Just because when you have PCOS, it's a metabolic issue, your hormones are already disrupted. If we're adding in extra stress and extra cortisol, that hormone itself can cause disruptions in progesterone and testosterone. So we don't want to add more fuel to this fire. So stress management techniques, good sleep, all of that plays a really good role too. So I always say those are our foundations: sleep, stress management, making sure that we have your vitamins and minerals in order. And then we add on these other things specifically for PCOS along with it. And if we want to explore a little bit more root cause of what could have triggered this outside of genetic predisposition, then we do dive into gut testing, mold testing, toxin testing, all those more specialty labs that we can do, just to see if those are impacting your hormones as well, give you kind of the best chance of having no symptoms. So that is my kind of spiel on it. And I want to see if anyone has any specific questions or concerns, or, just stories of anything that you want me to touch on. I'm happy to answer any questions at this point.
I have a quick question for you.
Yeah.
If we have a younger patient who is very athletic, could you over-exercise with the possibility of having PCOS? So if one's doing track in the morning and soccer at night, can you get too much exercise and it be problematic?
Yes, unfortunately, over-exercising is also, it can be an issue. And the main reason is not because we don't want you to be active and your body can't handle it. Because if someone is younger, their body typically probably can feel like they're handling it okay, but it does cause more of an inflammatory response and more cortisol release. So you need those rest periods. If someone is very athletic, which I have some patients who are, and they compete and do marathons and triathlons, we have to be very mindful of getting them active recovery consistently. So it's not that if they love their sports, they have to quit. It's more about when you're not in those activities, what are we doing to help your body recover? Adding in things like massage and sauna and everything else like that, in addition to just physically resting and sleeping. But yeah, I mean, short answer is yes, you can exercise too much.
Okay, thank you.
Yeah. And then someone asked, do you have a preference on a brand when it comes to inositol? So there's a couple of options I like. There's one capsule or two capsule versions that I like. and then a powder version. And so I like the powder version a lot because I've seen really good results with it, but it's harder to stay consistent with the powder. And I realize that. So that one, it's by a brand called Theralogics, and it's called Ovositol. And the reason I like that is because it's a really high dose with just one serving. So ideally you time it right before you eat a meal. I typically suggest do it in the morning, get it over with. But I also have a motto of I would rather you take supplements imperfectly than not at all. So if you forget, take it any time of day. You might not get all the absorption, but you're still going to get the benefits from it. And then if you would like a capsule version, there's a great brand that's actually made in Austin by, I think, an OBGYN and a PA called Chiral Balance. It's spelled CHIRAL. And that one, depending on your weight, it determines how many pills you take, but it's usually 2 to 4 pills a day. Kind of same thing, ideally before a meal. And then another brand that I don't have as much experience with, but I've had a couple patients use is Wholesome Story, and they have an inositol, and their serving is about 2 capsules a day as well. So those are some options, not saying they're the only options, but they're just the ones that I consistently use. And there are other products out there that are combinations that have inositol and berberine and other things in it together. But for the sake of PCOS, I do like to get a really high dose of inositol. So I prefer patients take that separately to make sure that we're getting good absorption and the right dose. And then, oh, sorry, was someone else going to ask? Okay, I have a couple more in the comments. How does hormonal birth control influence labs? Do I need to remove my IUD to get a true picture? So IUDs are a little bit different. If we're speaking about birth control pills, the way they work is they suppress your pituitary gland. And well, I should say they suppress the signaling in the pituitary gland of the ovaries. So there's these 2 signals called FSH and LH. They go from your pituitary here down to your ovaries and tell them to make estrogen, progesterone, ovulate, do all the things. So the way that a hormonal birth control pill works, it gets systemically in your bloodstream. Your pituitary gland recognizes, hey, I'm getting help from these outside hormones. So it stops signaling your ovaries. So if you were to check your labs on a birth control pill, your estrogen and progesterone are going to be very low, almost usually they are in the menopausal range, meaning no estrogen, no progesterone. But the synthetic estrogen and progesterone in birth control pills offers you some of the same benefits, just not quite as much as your natural production. So that's why I see a lot of side effects on the birth control pill as we get older, because our body's like, I want these hormones, I don't want these fake ones. It can cause inflammation and side effects. IUDs are a little bit different just because they don't get systemic, meaning the hormone that's in them, if you have a Mirena or a Kylena or one of those that has a little hormone in it, it's going to stay locally in your uterus and act somewhat on your ovaries, but you're not getting the bloodstream effect. It's not going to travel back to your pituitary gland nearly as aggressively. So your estrogen progesterone levels can still look pretty normal. And so can your FSH and LH brain signals. So I often will see a little bit lower levels of all those hormones in an IUD, but basically none of those with a hormonal birth control. So, or the pill, I should say. So if you're wanting to get a really accurate look at your hormones, then yes, I think the textbook answer would be you have to be off any kind of birth control, even an IUD. If you have the copper one, it won't impact it at all, so that doesn't matter. But I will say I can still get a pretty accurate picture of people's hormones with an IUD in place. So I would say it's worth getting labs done before you go to the extreme of getting an IUD removed. So that's kind of my take on it. And then can you speak more about insulin resistance from PCOS and postmenopause? Client is on HRT. Do you have referrals? In Austin, for gyno in Austin, that's HRT. I live in Dallas, so I don't want to speak too much. We can get referrals in Austin if you want for an OB specifically, but our providers in the Dallas clinic, some of them do hormone replacement therapy. And then those of us that are virtually in Dallas as well, like I do hormone replacement, Dr. Pero does. So definitely have hormone specialists here. If someone wants to be seen either virtually or not get the OB aspect with it in Austin. If someone lives in Dallas, Dr. Pero is an OB/GYN and she still does exams and things like that. So we don't have that in our clinic in Austin, but if you need an OB/GYN specifically for things like procedures, I can definitely get that. So in postmenopause, it's kind of a, I would say, misconception that when you go through menopause, PCOS disappears because again, it's a metabolic issue, not a hormone issue. Well, it becomes a hormone issue, but you know what I mean. So I would say that in my patients who are postmenopausal, that I do still see insulin resistance and they were diagnosed with PCOS when they were young, it doesn't just go away. So hormone replacement does help. Sometimes those patients are a lot more sensitive to the side effects of estrogen and testosterone specifically. So I have to be very careful with testosterone replacement and think about doing something like spironolactone or DIM or something like that along with it to offset the side effects. But in terms of treatment, it's honestly very similar. I still consider the inositol, the berberine, the lifestyle, getting the foundations all in place. But because it is primarily an insulin resistance issue, it's nice when you go through menopause because you don't maybe have the symptoms with irregular cycles and problems there, but you're still going to have the insulin resistance. And that's when if it becomes more of a problem postmenopausal with weight and blood sugar management, I get a little more aggressive with medications. So I hope that answers your question. And then when someone's only symptom is LH to FSH ratio and poor sleep, and they've done testing noting sluggish aromatase, any suggestions for natural ways to support aromatase activity? I would really say it's the more of the foundational things that would help with that. And for those who aren't familiar, I didn't mention this as one of the classic signs, but the FSH to LH ratio is often flipped in women that have PCOS, where FSH, the signal that regulates estrogen production and the growth of an egg, is typically higher than the LH except around ovulation. So in women where we see a higher LH that signals ovulation and progesterone production than FSH, we do think about PCOS because higher LH leads to more androgen production. So when it's flipped, it can be diagnostic of PCOS, but it's not to me, the ultimate marker. I think it goes along with all the other things that we look at. So if someone, let me go back to the question. Poor sleep and they've done testing, sluggish aromatase, I would really say more of the lifestyle things and looking more at nutrient deficiencies and what is their sex hormone binding globulin level and how we can fix that, because that often does help with the aromatase activity. And then thinking about supplements more along the lines of DIM to help with the testosterone level, I found that to be helpful too. So I hope that answers that question. And then peptides. Yes, this is a really great question. So in some women with PCOS who do really struggle with their weight and their insulin's very high, their sugar's very high, then we will often do the GLP-1s, which are the tirzepatide and semaglutide, because again, it's an insulin issue and those medications really help with insulin sensitization, which lowers your sugar, which corrects high testosterone, which leads to less observable symptoms, better regulation with your cycles too. So it's not my number one go-to for sure, but I do use it in women with PCOS whose weight is resistant. We've tried the other things, or that's one of their main reasons they're here is just their confidence is shot because they can't lose any weight. And that's something we'll do in addition to the other things. But it does work really well for people with PCOS. And I've used it quite a bit with success. Okay, those are all the questions that I have so far. Are there any others that anyone has? Make sure I'm caught up. Yeah, I don't think I saw any pop up. Okay. So for Anyone who has questions, you can feel free to call the clinic or reach out to us through Instagram, reach out to me through Instagram. I'm happy to answer any questions that you might have. But it is PCOS Awareness Month, so we'll probably do some more stuff with this. So I'm excited. And if you have any questions, please feel free to reach out.
Thank you.
All right. Thank you, everybody.